Many people are asking questions like, why did NDEB introduce this new situational judgment exam? We already had so many exams in the licensing process. Why would you do this? Trust me, this one exam is actually the most practical exam that you're going to use in your career as a dentist. Hi, welcome to Teacher Dentist. This is Sam Soni, and this is our situational judgment program. Once you graduate from this licensing process, when you get your certification and license to practice, you are going to be a dentist pretty soon. You will start working as either an associate or you will start your own practice. For that, you are going to need a lot more than dentistry skills. Yes, situational judgment and clinical skills exam, they prepare you for all dentistry related stuff, but there is more in dentistry than just dentistry. I know, paradox, but let's just dive into this course and try to learn what the situational judgment exam is going to ask you, because by end of this course and by end of passing this exam, you will be on the same level as a foreign trained dentist to a person who cleared the DDS program, because that's what the DDS program is all about. It's not just dentistry, but also so many aspects of patient care, patient-centered care, communication, collaboration, and a lot more things, patient information management and record management and data and prescriptions, referrals, how to communicate with the lab, how to communicate with specialists, how to communicate with patients, confidentiality. All these words are just like clumped up and put together in this one exam. So I'm excited to teach you this course. I hope it helps you in clearing your situational judgment exam. Let's learn what this exam is talking about and what is going to be covered in this exam step by step. Number one, NDEB released this one handout earlier, which gave us that there will be 5 requirements. Number 1 is going to be patient-centered care. Number 2 is going to be professionalism. Number 3 is communication and collaboration. Number 4 is practice and information management. And number 5 is health promotion. Later, they updated this handout and they gave us a new handout. And if you look around, not much has changed between the old handout and the new one. The first 4 things, a patient needs, managing patient needs, developing a problem list, establishing a diagnosis, and sequence of treatment plan is same. The only thing changed is developing a treatment plan is there, but they removed maintain records, because it's gonna come down here in maintaining records in this area anyways. So right here is maintain and manage patient records. Well, here it was just manage patient records. So just a small correction, nothing that bothers you. Number 2, professionalism is pretty much same. Ethical dilemmas, managing referral and social media use, it's gonna be same. I'm gonna dive deeper into each of these examples and what the requirements are about. But right now I'm just running an overview. Number 3 is where the thing has changed the most. Cultural competency is same, gathering data, maintaining privacy. Then instead of writing a referral, they have said prepare documentation for patient referral. That's one point. And then it's like similar, but they are not asking you to write a referral on paper, but they are asking you to prepare documentation. So what they changed is they might ask you that what else would you want to add to this referral. Hypothetically, if they give you a patient needs oral pathology referral, you saw a white lesion, you are suspicious, you want to write. So what else would you give along with a referral? How would you write a detailed referral to an oral pathologist so that the pathologist doesn't need to send you another email that can you send me this as well? Can you give me patient history as well? Is there a radiograph you have? Did you do anything else? Was there any history? And so many more things that a specialist, before even they see the patient, they might want to know. So you are going to prepare that proper documentation for those referrals. Next one comes draw a fixed or removable partial denture design. So we are exhaustively grilled on the removable partial denture design frameworks at our school in the DDS program, and I know this is not a straightforward thing. There is a lot of philosophies and school of thoughts and my style of doing something. So we will learn in this course how can you give a RPD design prescription to the lab so that there are no disputes, the lab is happy, they will exactly produce what you ask them to produce, and the patient care is delivered at the best way possible. Earlier, some foreign trained dentists were not trained on these communication with the lab part, and that's when things got a little glitchy between the lab and the dentist. So maybe that's why they put a new emphasis on this whole section. So I will dive way deeper into the RPD design as well as the FPD designs. Then write a prosthesis lab prescription. That's also like they first said that write lab prescription, but now they want to add prosthesis lab prescription. They just want to be more detailed about it. Discuss treatment, obtain informed consent, interact with staff, and give post-op instructions. This is all about communication and collaboration. The fourth part is practice and information management, in which we will have maintain and manage patient records, follow protocols, and make evidence-based decisions. And health promotion, nothing much changed here as well. Assess caries risk, demonstrate an understanding and social determinants of health, promote access to healthcare for all individuals, promote measures to prevent local disease injury, and advocate for your patients. So this is all this one exam entails as far as curriculum is concerned. Let's dive deeper into each of these requirements. Alright, so the first one is patient-centered care. What are we going to learn in this course? This is just an introduction video, so I just want to go over whatever NDEB want you to learn from the situational judgment exam from my understanding. First is manage patient's need. So patient's need cannot be just the dentistry related need. It can be respect related need. It can be need related to non-discriminatory and respectful communication. It could be come on time, show up on time, and there's so many social psychological needs, and there is a lot in plate, not just the root canal that you have to do on the patient. Second, develop a problem list. This is one of the things that we are working a lot in the schools. When we do our exam, we try to write down every single thing that we can find in that oral cavity, head and neck region. Actually, we start with all the lymph node examination, and we start with extra oral exam, like see if anything is happening on the skin around the vermilion area and around the ear. We just go all over the places. We notice the TMJ in the very first exam without even patient asking, without even any purpose in our mind. We do a complete thorough extraoral exam, and then we go intraorally. We do the intraoral exam, and if the patient's chief complaint was pain with this tooth, that comes as the last part for our entire exam. So throughout that exam, we develop a problem list. If the TMJ was clicking, that's a problem. If there is a small freckle here which is increasing in size, yes, that's a big problem. If intraorally you saw that 5 teeth have caries, some have like deeper caries, some have shallower caries, you will write down each and every finding in your problem list. So one thing is finding and one thing is problem list. We will talk a lot about that, what should be in finding and what should be in problem list. And sometimes we put things on observe, they lie between the findings and problem list. I'm throwing the words right now, just giving you an idea of what you will expect in this course that you are going to learn. Establish diagnoses. Yes, we are going to do a lot of test assessments and exams before we confirm our diagnosis. Sequencing a treatment plan. This is critical. And they talk about phase 1 and phase 2 treatment superficially in many textbooks, but in my education back in India, I never understood the real crux of phase 1 and phase 2 treatment and how they should be so different, and how we should always finish the phase 1 treatment, that too in proper sequence, before we even think about jumping on phase 2 treatment. Phase 2 treatment includes pros and ortho mostly. Everything else is phase 1. So we will learn that, and finally we will learn to create a treatment plan, which is going to be actually kind of a contract or an informed consent from your patient. So these kind of documentations are critical when you go out and practice dentistry in the real world. So that's why I keep saying this exam is going to be a very good learning experience for you, and you will take a lot from this course. Professionalism is the second requirement, which includes responding to ethical dilemmas. Now, unfortunately, all the schools, when they do interviews, they ask you a lot about ethics. AFK exam asks you about a few ethic questions, which is like very easy to answer these days, but actually, when you are sitting in front of a patient and an ethical dilemma shows up in front of you, how are you going to respond to that ethical dilemma? And later the instructor may ask you questions related to that. How would you respond to those? That is a very big thing, and it does not come instantly. And I think you might have it in you already. You might be able to reply to those ethical dilemma in a correct way. It's just that you don't know the terms behind it, or you don't know the principles, how they were applied in that particular situation. So we will check those out. We will learn how to manage referrals. Referrals is critical in our dentistry. We are general practitioners. Throughout this exam, I'll assume that you are a general practitioner, even though you were a specialist back home. You know all about your specialty. You don't need to do an endodontic diagnosis test because you were an endodontist in your home country. Still, we try to go over all the assessments way in detail so that nothing is missed out, and we send referral to the specialist to confirm the diagnosis, which are beyond my capacity or my skills and my caliber to judge in a very proficient way. And I should keep patient care highest, and my thinking that I know what it is. It should not be on top of my thing. Rather, I should know that who would be the best person to make this diagnosis for my patient. And last is use of social media appropriately. We don't know much what they are going to expect in this one, but mostly about fair use of social media, wrong publicity, or what publicity or advertisement should not be promoted. Also, what should dentists not share on social media? What should dentists and patient not share on social media? How should we train our staff on social media use, and a lot more. So I'm trying to pull out all the resources on this social media, because this is not something I learned at school a lot, but I have researched a lot for this course, so I'm putting a lot of resources, study material for social media appropriate use, and we'll see how that goes. Next one is going to be communication and collaboration. Now, this is a very, very critical part of a dentistry profession, because we learn that dentistry is the most important skill, but most old dentists, most practicing dentists would give you one example. They'll say, when you get into the real world, start practicing, the dentistry skills that you have are 10% of your everyday work. Rest 90% are your communication, collaboration, and practice management, because it is so much, a lot happening in that dental clinic, in that dental chair, and in all places around it, that you become more of a manager than a dentist, even when you are an associate, not even a practice owner. So there is a lot involved in communication and collaboration. So the first one is cultural competence. By cultural competence, you have to understand where the patient is coming from, what is their background in terms of religion, in terms of ethnic diversity, in terms of culture, gender, sexual orientation, financial status, social status, any other experience that the patient have. So understand that where the patient is coming from and what is their cultural background, and respect it, and show respect in every single aspect of your clinic. For example, there are many patients who may need some accessible options to get into the clinic and get into the dental chair, who are on wheelchair, or who have crutches, or who have any limitations in their means of moving around. For those patients, how is your clinic designed, and how is your staff trained, and how are you trained to demonstrate competence for serving that patient in most respectful and most comfortable way possible. Similarly, gathering data, whenever you have any question, whenever some situation arises, how do you gather data? Do you just go on Google, hey Google, how to do obturation after a root canal treatment? No, we don't do that. So how do you gather data? How efficiently can you find resources which can be trusted? Maintain privacy of the patient. That's a top thing, but I will talk more about this in the next part. And prepare documentation for referral. As I said, this is going to be something you do all the time throughout your practice. For every single patient, you might need to send them for some kind of referral to either their medical doctor if their medical condition is not good, to another specialist if they need some kind of treatment which is not done in your clinic. And there are so many things why you would want to write a referral. Then draw RPD design. This is one big chunk of this course which you will really enjoy, and I'll make sure that by end of this course you will be good in RPD design as well as FPD designs. Writing a prescription to the lab is critical. There are a lot of factors that need to be included in the lab prescription. Discuss treatment with the patient. Like, it has to be a to or fro to obtain informed consent, because this discussion is what is going to be documented. You mention all kind of like things that can go wrong, things that can cause problem. What is your best option? What if you don't want any treatment done, and all those things. How do you interact with your staff? So critical. Sometimes like this thing nobody's gonna teach you, but here they might put you in a situation where there is a conflict in the dental office, or a staff is behaving certain way with the patient. How would you correct it? What is the acceptable behavior? What are the boundaries among the dentist, dental hygienist, receptionist, and dental assistant, and so many other people involved in the patient care? And lastly, how do you give post-operative instructions? And they might ask you a demo for those. That was requirement number 3. And so the fourth requirement is practice and information management. Again, coming back to the same thing, you are going to start your practice or be an associate in someone else's practice. How do you maintain and manage patient records? How do you follow all the protocols, which I don't think anybody tested you on in so many other exams? And how do you make evidence-based decisions in everyday practice? That's what we will learn in this fourth part. The fifth part, health promotion, is again something that we are learning a lot at school, but when a foreign trained dentist pass these exams, that message is not sent across in a very clear and efficient way. So it's a good time that we learn how do we assess caries risk on each and every patient and find out if that patient could be low risk, medium risk, or high risk. Demonstrate understanding of social determinants of health, because we are the champions in the healthcare. As a dentist, we have the highest level of knowledge in our community whenever it comes to dentistry and oral health. So we have to identify all social determinants of health and what our population, the population we are serving in our dental practice, what kind of social determinants of health are we going to observe, and how can we address any challenges that population is facing. We have to promote access to care for all individuals. I gave you an example. For example, a person has limited mobility. How can you improve access to care for that patient? Also, if a person lives far away, what do you do as a dentist? What is your contribution in order to ensure there is access to care for people who are living further away, geographically or financially as well, like further away as in they cannot afford the treatment. Also promote measures to prevent oral diseases and injury. This includes avulsion, which is a very common topic, and they would give you a situation around avulsion probably, because that's something they always want to ask about. Or night guards is another one, mouth guards for sports is another one. So they might give you these kind of situations. Measures to prevent oral injury and prevent diseases is, of course, stop smoking, smoking cessation or tobacco cessation, as well as brushing, flossing, oral health, oral hygiene instructions. Advocacy for patients. Patients do not know a lot about dentistry except how they found out about from Google. So you have to advocate for your patients. A weird example would be if a certain product is available in the market suddenly in your superstore next to you, and which is something which would not be good for your patients, then how would the patient exactly know that this thing is going to be good for them or not? Rather, you as a dentist are going to be advocate for your patients and try to find out what would be the best thing for your patient when it comes to selecting between certain products. So that's a little off the radar, but it is kind of a topic when you will be advocating for your patients. I hope I covered a lot of things on this one topic. This is one framework that has been used by most of the dental programs. It is called ACFT, Education Framework for the Development of Competency in Dental Programs. And how would you be a competent dentist? The competent beginning general dentist, not just a very competent dentist in field ahead, because you would need a lot of more things to become an experienced dentist. But as a beginner dentist, you should have all these requirements which we discussed right now fulfilled, and only then you will be like super nice general dentist that NDEB is trying to prepare you at. Okay, so just a framework to give you a highlight why we are having these 5 requirements here. NDEB did not make it up. These are actually coming from this ACFT framework. Okay. What will the situational judgment exam test you on? So it will test you on your skills to manage situations in dental office, your professionalism, how you care for your patients, communication and teamwork in the healthcare team, and who's in charge of that healthcare team, who's running the show there. It's you. It's not the problem, hey, my receptionist did that, I had no control on it, or my dental assistant did it, it's not my problem. No. As a person who is a dentist in that facility, you are responsible for everything that is happening in your dental setting. Managing a dental practice is super important. Management of information in dental office, that's what they are worried about. They don't know if you're making money in the practice or not. Are you financially doing okay or not? What they want to know is your patient care and your information management is up to the mark. Promotion of health, as I said, that's our job as a dentist. And lastly, charting is part of situational judgment now, not clinical skills. So you will be charting, but most of these charting will come in the record management, and we will discuss a lot about this in this course, how you are going to maintain records, what is the sequence to follow, and that's how your situational judgment exam should look like. There will be 10 stations, so you can think of it as 10 questions that you have to answer, or 10 kind of assessments that will happen in that one exam. In 10 station, all station will have same time duration. Some people say it's 8 minutes, some people say it's 15 minutes. 15 minutes is overall turnaround time, while 8 minutes is to answer a question or to write down certain things. So I will, in the course further, I will tell you exactly when you would need to have a faster way of doing things, and when can you slow down and take your time to answer the questions. Scenario based, 2 stations for each core competency. That means 2 for communication collaboration, 2 for patient-centered care, and 2 for information management, and so on. Scenarios will be based, these are all scenario based. Write answer to the question based on the scenario. That's when you will be writing things. Example would be if you see a radiograph in front of you and some other things, then you have to write down what you find, like so writing findings, writing problem list, and creating a treatment plan in a proper treatment planning sequence. That would be a writing scenario. Talking to a person or patient about the scenario is something that is always done in med schools, and they always have an actor who works as a patient, and they kind of try to trick you with things. Sometimes they are cooperative, sometimes they are super non-cooperative, sometimes they will not give away an information unless you really probe to find that information out. And how do you act in the stressful situation, because exam is going to be stressful. This is going to be close to the real life scenario where you will be under stress, and the patient is giving you more stress by not giving out information, being uncooperative, being unruly and stuff. So how would you act and how would you communicate with that patient? So English would be tested there in certain levels. Don't worry too much if your English is not so sound. It is not an exam for English language assessment. It is an exam for your communication skill. So if you are able to just convey the message through, and you have a good soft spoken communication skill, and you are respectful to the patient, then yes, you will be okay in this exam. Reviewing literature material and answer question based on this material, because you just learned that we have to gather data, right? So how would you gather data? You are going to review certain materials, and based on that you are going to come and make a evidence-based decision about patient care, about accepting a new product from the dental company or a drug company, or just accepting something new should not come from the medical representative or the dental equipment representative. It should come from your evidence-based research. So that's why reviewing articles, materials, and answering questions based on that. Watching a video and answering questions based on that. If they could not give you an actor, or if they give you a situation where, for example, there was a medical office emergency, they will show you a medical office emergency, and they will just ask you what were the 5 things that the dentist did wrong, or what were the 3 things that you would have done differently in this certain situation. So that could be watching the video and answering the questions based on that. It could also be some ethical scenario where they cannot have an actor in front of you disrespecting another patient, or a patient disrespecting your colleague, dental hygienist or another staff member. Rather, they would give you a video which would be more easier for them, and then they will ask you a question based on that. Those will be your 10 stations in the situational judgment exam. How do we get assessed for this exam? So there would be pass or fail. Good thing. Either you are competent, minimally competent, or not competent at all. So we will dive deeper into these rubrics, and for every time once you finish the course, we will do an assessment. Like there would be mock exams. You have an option to select the mock situational judgment assessments with me, and in those exams I will give you feedback based on these rubrics. In the handout again, they have given you a station example. Patient-centered care station would include a short scenario such as: this patient presents in emergency complaining of low-grade pain to the tooth 4-1. The tooth was restored years ago. You take periapical radiograph, probing depth on 2 to 3 mm. Periapical radiograph is provided on the side. Discuss treatment options for tooth 4-1 with the patient. So it is such a good way of making sure that you just don't know how to diagnose something, but you have to also communicate with the patient, explain to them what is something that you're looking at, explain that in a layman word and as easy as possible, and what are possible treatment options. Is there another test required? Anything else that the patient need to do? Are any other teeth going through the similar scenario? Or what is the reason for this problem? How can patient prevent this thing to happen in future? You might have done that in past, because I know you are internationally trained dentists, foreign trained dentists if you're watching this video and you're joining this course. But keep in mind that the exam wants to make sure all dentists who pass this licensing exam have this minimum communication skill. Okay, so based on that, they have given us a rubric that we will assess you on all these things right here. And if you make a critical error, then you are not competent. So you can see that even if you are minimally competent, you will do at least the basic things. I don't want to jump into it right now, but in the course and during our mocks, I will try to go as deep as possible in these things. So grading is something that we understood. How is grading of situational exam done? So you might access it via video recording. They might send you a video that you did this good, but you were missing on these two things. There will be 4 evaluation sessions each year, and it's super competitive to book it. So I would encourage you that you sit there. If they say it would be released at 9 a.m. of Toronto time, then you have to be on your computer 15 minutes before that, log into your account and keep refreshing, or whatever is the way to get that spot booked. Just make sure you book that spot. Passing marks are 6 out of 10. That means if you fail 4 stations, you did something horrible in 4 stations. For example, your RPD design was absolutely wrong. You don't have to worry too much. If you pass 6, then you will be okay. How do the stations, this is an arrow. How do stations look like? So this is how a station for informed consent might look like. That patient is in front of you, or you're watching a video and you are discussing things with your patient. There might be a station for writing chart notes. So you might be in front of a computer. You might have a few images here and there, radiographs in your hand, or whatever they might want to provide you. And then you'll be typing notes in the computer. Or responding to ethical dilemmas. That might happen with a video, that might happen with a patient in front of you, or that might happen when an instructor gives you a written situation and you have to talk about it. It's not too much writing. Do not put stress on writing about ethical dilemma, rather put a stress on speaking about ethical dilemmas. This is how NDECC facility looks like now. They have done all the new refurbished and cool stuff there. So I'm not talking about anything related to the clinical skills. So, but still, if you want to know more, go on the NDECC brochure and you can read pretty much everything. There are 1,200 seats. Spots will be available throughout the year. 20 examinees per 2-day session. 1 day would be situational and 1 day would be clinical. Calibrated assessments and registrations are open since September. So I already know so many who got registered, and that's why I'm rushing on creating this course so that I can benefit the most of you. Disclaimer, I'm not associated with NDEB. This is only a guide to do your own, this is only a guide. You do your own research pretty well, and make sure you follow all other resources available, and whichever reference books you are using, which were given by NDEB already, you follow those textbooks, and make sure you do a well-informed study before you go for this exam. But I will do my best to bring out the knowledge that I have received from my university, from my education, and as well as my experience here, and I will share that with you in the mocks as well. So I'll be looking forward to your joining this course, and we will start with the first part, which is patient-centered care. See you. Click on the link in the description below or somewhere here on the screen to join the Situational Judgment Prep course with teacher Dentist. This is just an introduction video, but there's a lot of resources as well as mock sessions that will be offered via that course. So make sure you click on the link and join the course as soon as possible. Wish you all the best for your exam. Take care. Bye.